Hi, are you pregnant and you're scared of pain during labor? Has your mother or grandmother told you labor pain is the worst pain in their lifetime? I'm Dr. Deepeka. I'm going to talk about epidural analgesia. What is epidural analgesia? It is the most commonly used and most effective method of managing pain during labor. Every time the labor pain is there, the uterus contracts, and when the head stretches the birth canal, it is always associated with pain. So what happens if you take epidural analgesia? Your anesthetist will evaluate you and insert a small catheter-like tube-like structure into the lower back and inject some medicines. These medicines will reduce the severe pain associated with the uterus contraction and as well as the birth canal stretching, so that you will not feel the severe pain, but it will not affect the uterus contractions nor the stretching of the birth canal. You can feel the contraction. You can feel whenever the baby's head stretches the birth canal, and you will feel when you have to push. So do not worry about that part. So when to start taking the epidural analgesia? When you're in labor, when the active and regular pain starts, your doctor will suggest you to take epidural analgesia. What are the advantages of taking epidural analgesia? It is that you can rest, you can save energy, and you can push during the active final phase of the labor, and you can avoid the agitation and the irritation every time the pain comes. And some women tends to shout. Some women says, "Doctor, I don't want to undergo this. Please take me for cesarean section." All these agonizing part can be avoided when you take epidural analgesia. Does taking epidural slows down your labor? Yes, sometimes in some women, but it doesn't affect the outcome for you or your baby. Does taking epidural analgesia cause backache? No. If someone told you that they had backache after epidural analgesia, it is just because their position during labor, not because of epidural analgesia. Does epidural analgesia increases the chance of cesarean section? No, not at all. If someone had a cesarean section after taking epidural, it may be because of their birth canal or their baby size or position, not because of taking epidural. Can you tell me what are the contraindications? Who cannot take epidural analgesia? Yes, good question. If you have any bleeding disorders, or if your platelet count is low, or if you have any infection in your back, or if you have any allergies to local anesthesia, you cannot take epidural analgesia. What are the side effects? Side effects for epidural analgesia is very rare. If at all, it can be mild itching, numbness, or mild headache after the process, which is temporary. So if you're scared of labor pain, you want some relief, talk to your doctor around 36 weeks about epidural analgesia.